Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our video series for both parents and patients and students. This video today is really designed for students, but interested parents can certainly enjoy this as well. Please remember that our videos are not intended to replace consultation with a physician. If you have concerns about your child, give us a call. We'll be happy to see you here in our office. Our phone number is area code 775-359-7111. Today what we want to talk about is something that's a little complicated. It goes back to our very basic biochemistry education as healthcare providers, and it's something that's lost on a lot of people who take care of children, and that's how to take, or that is really what happens with bilirubin during phototherapy. And what are we doing? When I ask students and I poll students as to why we use phototherapy, often referred to as Billy lights, they usually tell me that it breaks down bilirubin, and that's not really accurate. When we use phototherapy, we're not breaking any covalent bonds. The amount of energy necessary to break covalent bonds is ionizing energy. Okay, you need the energy. If you're going to break covalent bonds, you need the energy of radiation, radiotherapy, and that will break covalent bonds everywhere, including in DNA and in cell walls, and causes death of cell structures. It's very dangerous. We don't want ionizing radiation. So what is it that the sun is doing? Well, first thing you need to recognize is that we're using lights to do this, and the light range that we're interested in really is 450 nanometers. Bilirubin maximally absorbs 450 nanometer light. What we use on patients is a bit of a spectrum. We're not using laser beams, so we're using light in the spectrum between 425 and 475 nanometers with an average wavelength of 450 nanometers. That light needs to be positioned somewhere between 12 and 30 centimeters from the patient, depending on thermal stability of the patient. And you need to watch and make sure that the child doesn't get cold, because that's the one major risk of phototherapy. Bilirubin exists in nature as a single isomer, meaning one configuration. However, we're going to change isomers with the phototherapy. So we're going to start with the two-dimensional model, a drawing. Bilirubin has two double bonds, and we're really interested only in the first double bond. It exists in what is known as the ZZ configuration. Z means that the large chains coming off the bilirubin, here in this model referred to as R, are on opposite sides of one another. Carbon molecules with a double bond are flat planar molecules, and although molecules exist in 3 dimensions, when you have a double bond, you really have turned something into a piece of paper. These large R groups are as far away from one another as they can get, because they are huge and they would interfere with each other's magnetic fields. And we hold them rigidly bound as far away from one another as they can get with this double bond. When we hit this with 450 nanometers of light, it pours energy into the system, weakens but does not break the double bond, allows the high energy structure to form known as the E, Z configuration. And in the E configuration, the two large R groups are pointed in the same direction, either up or down. Now, because these groups are giant and they're bouncing off of one another and they're getting in each other's way, kind of like two toddler siblings being stuck next to each other in car seats, they have to be held in place with a rigid double bond, car seats, to hold them in place. Because ideally those toddlers want to go to opposite directions. Why do we want this high energy configuration? Because this one is substantially more water soluble than this one. This one will be excreted by the kidneys. This one is excreted by the gut. And so it allows us to drop the bilirubin levels a little. But we don't break covalent bonds. We don't turn a double bond into a single bond. We don't snap the bilirubin molecule into two separate molecules at the point of the double bond. That double bond is kept intact. So, looking at a three-dimensional molecule, how does that happen? Okay, this is the Z configuration. The big R groups go in opposite directions, as far away from one another as possible. The molecule is planar. It can't really twist because of the double bond. We transiently weaken, one of the double bonds, allowing the molecule to rotate into its high energy configuration, and then again leave it rigid. Now it's in the E configuration. These groups are actually giant balls. You can imagine basketballs on the end of these. Or even bigger than basketballs. 5 times the size of basketballs on the end of these. 50 times the size of basketballs on the end of these. And you can imagine how they're trying to bounce into one another if they're as big as my chair. Okay? But they're held this way, and now it's water soluble. Now we can excrete it by the kidneys. But we never broke the bond. Okay? A broken bond would mean getting rid of that double bond and perhaps putting a hydrogen molecule on each end, something vaguely like this, which would then allow the molecule to spin. We haven't done that. Why do we care? Again, if you are breaking bonds, you're using ionizing radiation. Parents will hear you're using radiation on their child. They're scared. Radiation is a bad thing. Ionizing radiation is a bad thing. This is UV radiation. It is very low intensity radiation. It's not going to break covalent bonds. It doesn't set you up for skin damage. It doesn't set you up for skin cancer. It doesn't set you up for other kinds of soft tissue or for other kinds of tissue cancers, leukemia, etc. You're not being put inside a nuclear power plant. You're being exposed to sunlight in the 425 to 475 nanometer range, a very narrow portion of the visible spectrum. I hope that this has been educational and helps you understand what we're doing. I think it's very important to understand the molecular basis for what we're doing, to demystify some of what we're doing, and to help understand future research as it comes out. If we can be of assistance here for consultation for your patient, or for an educational rotation for graduate students, give us a call at area code 775-359-7111. We'll see you next time.